juice.
अथ तो रक्ताभिष्यन्द प्रतिषेधं व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः. As we have discussed earlier, though the chapter says about the treatment of Raktabhishyanda, in this chapter you have the description of the disease, treatment of many of the other diseases also, which are medically treatable. Mandham, Syandam, Sirotpatam, Siraharsham च रक्तजम् एकैनैव विधानेन चिकित्से चतुरोगदान. The Adhimanta, Abhishyanda, Sirotpata and Siraharsha, these can be treated in the same manner. The protocol of the treatment would be same. व्याख्यास्तान् चतुरो अप्येतान् स्निग्धान् कौम्भेन सर्पिषा रसैः उदारैः कबासिरा मोक्षेण योजयेत. Now in all these four conditions, Sarpik Kumbha or a pot filled with the ghee is used to apply some svedana over the eyes, and or Siramoksha is also done. The other way is Siramoksha. Viriktanam prakramam cha shiram sesham vishodhayet vairechanika siddhena sita yuktena sarpisha majnama tadvimishredam yadasartat shrusenava. After the Siramoksha, Siravirechana, then Shiro Virechana is to be done. Shiro Virechana is done by Vairechanika Siddha Sarpihi, any of the ghees which are prepared with Vairechanika Dravya, or it could be the Majja or Medas also could be used with the for the Shiro Virechana Nasya. Tada Pradeha Parishechanani Nasyani Dhumashethaswamema Aschotana Abhyanjana Tarpanani Snigdhashcha Karyaha Putapaka Yogaha. The other protocols could be used are Pradeha, local application over there, or Parishechana, pouring of liquids over the eyes, or eye wash as such. Nasya, of course, the same. Dhumapana, or Aschotana, Abhyanjana, and Putapaka. Aschotana is where you put in a good amount of oil or ghee into the eyes and then keep it as such, what we call as now Tarpana, similar protocol. Abhyanjana is just application of the eye and rubbing over the palpebral, and Putapaka is the Putapaka yoga, that's the leaf, the drugs are covered with the leaf, and then the leaf is kept in a coal, heated coal, and when it is just hot, it is kept over the eyes. Now these are the different protocols of the treatment. Of course, practically now using these are being done, of course, that use of these techniques are done, but with certain variations in the total approach. Nilotpala Ushira Katankateri Kariya Yasti Madhumustarudhihi Sapagnakaihi Dhautagrata Pradigdehi Akshno Pralepum Prarita Prakuryata. A lepa is applied which can be applied around the eyes and with all that Pittaharadravas, Nilotpala Ushira, etc. Then Rujayam cha Tibhrisham Svedashtam Mridavohitaha Akshnoh Samantarakaryam Patanja Jalokasam Grisasya Mahati Matra Pita cha Artim Niyachati Pittabhishyanda Shamanaha Vidishchapi Upapaditaha. In severe pain conditions of Raktabhishyanda, the Jalokas can be used, Mrudu Sweda has to be done, and a patient has to be given large amount of the ghee to be consumed in, and all other protocols of the Pittabhishyanda also are suggested in case of the Raktabhishyanda. Kasheru Madhukabhyama Chunam Ambara Samrutam Nestam Apsu Antarikshasu Hitam Aschyotanam Bhaveta. For Aschyotana, that's for pouring of the liquid into the eye, the drug prepared could be Kasheru Madhuka Churna, and it with the Antariksha Jala. Antariksha Jala is the rainwater collected directly is Antariksha Jala, and this is used for the Ashwatana. Patali Arjuna Sriparni Dhataki Dhati Bilvadaha Pushpani Atha Brihatyoscha Bimbi Lotas Tulashaha Samanjisthani Mudana Pistani Ikshurasenava Raktabhishyanda Shantyartham Etad Anjana Mishade. Another of the Anjana Yoga, Coryllium, which are to be prepared with these drugs like Patala, Arjuna, Sriparni, etc. And with the Ikshurasa, with the sugarcane juice, the collyrium is prepared and then applied over the eyes. Chandanam Kumudam Patram Shiradit Zakungamam Ayas Tamrasutham Nimba Niryasamanjanam Trapu Kamsim Chapi Pushtua Pushparasenato Vipulava Krudaha Bhartyaham Pujitashta Anjane Sada. Another of the Anjana Yoga are worthy directly can be applied into the eyes. Now, interestingly, Sushila has used metal powders like iron, copper, metal powders also are used along with the plant drugs into the eyes. Kamsimala is the precipitate over the bronze vessel, copper sulfate rather, the kilogold. That sort of the things like. So, metallic substances are also very used in the eyes. In the present day situation, how far it is practicable, because metal may not be get dissolved in this medium of chandana kumara etc. With or pushparasa, that juice of different flowers. So it's a question mark, like whether really they can be used or not, or what should be the chemical presentation of these metals. It's again a bit question mark. Practically to do that, there would be a hesitation now. Sat Anjanam Ghazam Kshaudram Sirotpatasya Bheshajam Tadvat Saindavakasisam Stanyakristam Pujitam Madhuna Shankare Vati Duddha Davyaha Sasaindavaha Rasa Shirisha Pushpascha Sura Marichamakshikehi Yuktam to Madhuna Vapi Gairikam Hitamanjane. Of course, for the conjunctivitis of different sorts now, the current treatment would be same thing, like where you may apply locally either the decongestants or antibiotics or antiviral drugs also could be applied over there. So most of the times for the conjunctivitis in the present situation, the treatment is local treatment of different sorts as such. Now for the other conditions like Sirotpata, Sushila has suggested about Anjana, Ghata or Kshaudra or Saindhava and Kasisa with the stanya, with breast milk, they also can be used with in the form of Anjana. Or Madhu, Shankha, Nepali, Tutha, Darvi, Saindhava, Shirisha Pushpa, then Maricha, Makshika also can be used for the Anjana with Gairika also. Siraharshe Anjanam Kuryat, Phanitam, Madhusanitam, Madhuna, Takshiram, Vapi, Kasisam, Vas, Saindhavam, Vetra, Amlas, Tanya Sanyuktam, Phanitam, Tisa Saindhavam, Vetra, Amlas, Tanya Sanyuktam. Now, Siraharshe, in the Siraharsha condition also, Anjana is prepared with the phanita, that's a variety of fermented product with madhu. Now, for Siraharsha and Sirotpata, we have considered it could be like a scleritis. In the present day situation, scleritis is again one of the common condition, and most of the times the causes would be autoimmune phenomena than really any local causes. Majority of the conditions it's a autoimmune phenomena, and the scleritis is categorized into two categories: anterior and posterior. Anterior is where you can see the lesions over the area, and the posterior is that would be pain because of the development of the scleritis in the posterior segment and cannot be diagnosed clinically. Only the complaint would be pain in the eyes, and you need only the MRI images or the ultrasonography also can make the diagnosis now. And almost every condition there would be some autoimmune phenomena, either rheumatoid pathology or so on, SLE and so on. And only in 43% there could be a presentation only in the eyes but not elsewhere. In other conditions there would be the lesions in the elsewhere too, like joint, skin, etc., depending upon the type of the autoimmune disorder. A large number of autoimmune disorders are presented with the eye signs, and the common eye signs in that condition is scleritis. The characteristic clinical symptom would be severe pain, particularly in the posterior scleritis, severe pain that radiates to the forehead, brow, or so on, which often produce some confusion with the other conditions. And the pain is so severe that it awakens the patient during the night, and it is increased by touch and it's excessively tender. And analgesics do not relieve it completely. That's also the other signs. Complications, it can result in keratopathy, that's the ultimately keratinization, and uveitis, inflammation of the uveal glands, glaucoma, cataract or fundus abnormalities could occur as a complication. Prognosis of scleritis in spondyloarthropathies or systemic lupus erythematosus usually are not so harmful. They are self-limiting. Once the acute condition is treated, it could be that it may reduce. Whereas scleritis in granulomatosis or polyangiitis and can lead to permanent blindness. So because of the scarification. Rheumatoid arthritis and relapsing polychondritis also it may have an intermediate severity. So most of the times scleritis is now considered as a complication of the systemic disorder, and the prognosis also is based upon the primary systemic disorder of the autoimmune nature. And if it becomes necrotizing, then again there could be serious complications. Then most other systemic disorders, most of the times it's benign, because once the autoimmune disease is controlled with the usual treatment like systemic NSAIDs, corticosteroids or so on, or any other immunomodulatory drugs. Scleral grafts is the last resort if there is a keratopathy. From the current, our point of view, most of the times the treatment will be the same like usual treatment of rheumatoid arthritis or any other primary pathology. Akshitarpana could be the additional treatment. That's about the Sirotpata and Siraharsha. Then comes the Arjuna. Paitam Vidhim Asheshena Kuryad Arjuna Shante Ikshuk Shaudra Sita Stanya Darvi Madhuka Sindhavihi Sekanjanam Chatra Hitam Amblehi Ashchotram Tadha Sita Madhuka Katwanga Mastuk Shaudramla Sindhavihi Bijapuraka Kolambla Gadim Amleshta Yuktivaha Ekasho Vabhisho Vapi Yojitam Tribhi Spatikam Vidrumam Shankho Madhukam Madhujai Vacha Madhujaivahi Shankak Shaudra Sita Yukta Samudra Pyane Vacha Dvaimo Hitavo Yogo Anjane Arjuna Nashanam Saindav Shaudra Katakaha Sakshodram Marasanjanam Kasisam Madhuna Vapi Yojam Atra Anjane Sada. For the Arjuna, that's subconjunctival ecchymosis or subconjunctival hemorrhages conditions, Sushila has given elaborate protocols of the treatment where Anjana is the main course of the treatment. Drugs which could be used for the Anjana could be, that list is given, and any number of these drugs could be taken, either 1, 2 or maybe 4 of these drugs could be taken, and then the Anjana has to be prepared. So Anjana is the suggested treatment. Then again, Lohachurnani Sarvani Dhatavo Lavadani Cha Ratnani Dantaha Shringani Ganaschapi Avasadanaha Kukutanda Kapalani Lashanam Kadakatrem Karanja Bijam Yelacha Lekhyanjanam Idam Smritam Putapaka Avasanena Raktastravana Adina Sampatila Sevidina Krutsunena Sendaghatina. Now another of the Anjana, where again you will have many insoluble materials like Lohachurna and Sarvani Dhata, all the minerals, Labanas, salts, Ratna, that's the jewels or valuable stones, Dantaha, teeth of animals, Shringa, horses of the animals. These are used for, and Kukutanda, Kapala, the eggshell, Lashuna, and Tikatu. I think this, if at all we prepare a Anjana of this, it will be highly irritant. Now whether that's really needed or not, that's the next question mark. But Sushila has suggested this as a Lekhyanjana, which could be used in case of subconjunctival hemorrhage conditions, ecchymosis conditions. And all that Raktabhishyanda to Putapaka, all that protocols which are mentioned in the Abhishyanda, they also can be used in the same protocols also are used in Avrana Shukra also, Avrana Shukra conditions also. Uttanam Avagadam Karkasham Vapi Savranam Shirisha Bijamarita Pipari Saindhavedapi Shukrasya Gharshanam Karyam Athava Saindhavenatu Kuryat Tamrataja Shankhashila Marita Saindhavehi Antya Biguna Dugunitihi Ebhi Anjanam Shukrashanam Kuryat Anjana Yoga Samyak Shlokarchika Imo Shankha Kolasti Kataka Draksha Madhukamakshikaihi Shaudra Danta Arnava Mala. Arnamala is same Samudra. Shirisha Kushmerapi Ksharanjanam Vabitaret Balasa Grachitapaham Balasa Grachita and the Savrana Shukla. The treatment suggested is a local application of irritant substances in like the Shirisha Bija, etc. And Gharshana, it has to be friction over the area is done. And मुद्गान् वा निस्तुषान् भृष्टान् शङ्खक्षौद्रसितायितान् मधुकसारं मधुना योजयित्याञ्जने सदा बिबीजकास्तिमध्याच सक्षौद्रशुक्रनाशनः शङ्खशुक्ति मधुद्राक्ष मधुकं गतकाञ्च द्वित्वगते शशूरे वातग्नं तर्पणं हिदं वंशज अरुष्करौ कालं नारिकेलं च दाहेत् विस्रावे क्षारवच्चूर्णं भावेत् करभास्त्यजं बहुशो अंजनम एतत् स्यात् shukravaivarnyanashanam. Now the other protocols of Ganjana also could be prepared with the madhukasara, madhu or the vivijakasti seeds of vivitaki or karabhasti, that's the camel's bones also are used to, and churna of camel's bones also can be used for anjana. Now practical use of these I don't know. Now as far as the subconjunctival hemorrhage Arjuna is concerned, from the current point of view, current astrological point of view, most of the times the causes are trauma or straining and are patients who have systemic coagulation. There is no specific treatment required. Majority of these subconjunctival hemorrhages, they would heal by themselves unless the patient has a systemic coagulation disorder. In the systemic coagulation disorder like in the hemophilia and so on, you may require a specific treatment or the condition whether it is curable or not depends upon that primary condition. Whereas in other trauma and straining condition induced subconjunctival hemorrhages, almost every patient would have a complete recovery, spontaneous recovery, and there is no need of any specific treatment. So all that rigorous treatment which is suggested by Sushruta, whether they are really needed in a case of subconjunctival hemorrhage or not is a big question mark. In the current protocol, all that which could be recommended to the patient would be keeping the eyeballs clean with the saline wash. Then as far as the corneal ulcers are concerned, the corneal ulcer is one of the grievous pathology which can result in lots of complications in the present day situation, and identification of the corneal ulcer also is quite difficult. In the early stages it may not be identified easily. It needs a split clamp examination to confirm the corneal ulcer majority of the conditions. Now the corneal ulcers could be a bacterial keratitis or the corneal ulcer, which are the common names, but this also is a confusing issue, like whether it's a bacterial keratitis or ulceration as such. Causes could be infective where it's a primarily bacterial, or it could be as a complication of the systemic disorder like rheumatoid arthritis, Sjogren's, SLE, scleroderma and so on. So as in case of the scleritis, corneal ulcers could be the complications. But corneal ulcers are more common causes of the blindness now, and hence you need to discuss it somewhat in more detail. And the staging could be based upon stage of progressive infiltration, stage of active ulceration, stage of regression, and stage of cicatrization, which is the last stage where the cornea becomes completely scarified. The same is confirmed by the slit lamp examination. It's also called as the types, type 1, type 2, type 3, 4, depending upon the depth of the ulcer, corneal ulcer. And type 4 is almost results in the cicatrization and is quite deep as such. This depth also can be measured only with the slit lamp examination. So simple clinical examination or a torchlight examination may not confirm the corneal ulcer in the early stages. Later on, when it becomes quite huge or scarified, of course it is seen as such. Treatment protocols, the present day's protocol of the treatment, there are some specific liquids which could be used to keep the eyes moist. This is called as preservative free artificial tears, and lots of them are there, and which can keep the eyes clean without forming that punctum plugs or as such. And then corneal lenses, contact lenses also can be used as such. And often the small corneal ulcers may be caused by dry eye syndrome and can benefit from such treatment. Then patients who have the corneal ulcers also tend to have spasm of the pupils, and hence cycloplegic agents also can be often given, and immunosuppressive agents for systemic pathologies. Broad spectrum antibiotics, local antibiotics also are used as a main treatment as such. Systemic immunosuppressant drugs in case of the systemic pathology would be the protocol of the treatment. One of the important issue is the corneal ulcers, if they become chronic, if they are irritated, they may produce more scars as such. So whether the same protocol mentioned by Sushruta, whether it can be used in a corneal ulcer, still I have doubt, I don't know. I am not sure about that. Then the next is about the Ajakajata. Ajakam Pashado Vidha Sucha Visraveta Udakam Vranam Gomam Saturna Purayat Sarpashasaha Bahusho Avadikhet Chapi Vartnasya Upagatam Yadi. Now Ajakajata is a projection over the surface of the sclera which looks like bulge, and that's what we call as the cephaloma. Now the in that condition Sushruta suggests about use of Visravana, that the fluid is aspirated out and the wound is treated with Gomamsa Churna. Gomamsa Churna is one of the very odd sort of the product which is used with the sarpi, with ghee as such. And avalekhana, lekhana is done if it involves the vartma or the palpebral. From the current point of view, cephaloma is again categorized into 4 categories: primary posterior pole, depending upon the location, macular area, peripapillary area, and fundus nasal to the disc. These are the locations. Treatment now, of course, mainly surgical. Either it could be the scleral reinforcement or lamellar keratoplasty, complicated surgeries, very sophisticated surgeries, and virtually there is no medical treatment known for cephaloma. Then the akshipaka, sashofascha, ashofascha, dopakau yo prakirtro, sneha svedopavannasya tatra vidhvasiram bhishaka, sekashcha astyotana nasyani putapakhamshakare. In the akshipaka, endophthalmitis, where the whole of the eyeball has become all panophthalmitis conditions, where the eyeball is infected, or it can result in a cicatrization, constriction, avrana, as such, or ashopa akshipaka. In these conditions, the treatment is a snehasvedana, sirabhyasa, and local sveka, ashtotana, nasya, putapaka are suggested. Sarvadashchapi siddhasya kartavyam vidamanjanam tamrapatrasthitam mamsam sarpis saindava sanyutam maireyam vapitadhyevam dadhi uttarakam evacha ghritam kamsyam alopetam stanyam vapi sasaindhavam madhukasaram madhuna tulyamsham gairikena va sarpis saindava tamrani yoshis stanyayutani va. Now the other yoga which are suggested are the ghee which is kept in a copper vessel for a month with the saindava lavana, and Maileya is one of the fermented product, alcoholic variations, or dadhi, curds, or dadhi uttaraka is the whey water, then ghruta, kamsemala, that residue over the bronze vessel, and stanya, breast milk with the saindava. Any of these could be used for the local application, and the other madhukasara, madhuna, etc. Dadima arevata Shamanta Kolamlish Sasindom Rasakriyam Abhitareta Samyak Pakadikhamsaya, to prevent the separation, they prevent the sexes. The Rasakriya prepared out of Dadima Arevata etc. can be used as one of the options. Masam Saindava Sanyuktam Stim Sarpishinagaram Ashtotana Anjanam Yajam Balak Shira Sanyatam. The other yoga is Saindava Yukta Ghruta with the Shunti, also is used for Ashtotana and Anjana. Jatya Pushpam Saindhavam Sringaveram Krishna Bijam Kirashitroshchasaram Etat Pishtam Netapaki Anjanartham Shautropetam Nirvishankam Prayajam. Jati Pushpa and Saindhava Shunti Krishna Bija is that Pipali. Kirashitru is Gugulu. With this you may use for the Anjana, which can be used without any doubt. Now, as far as the endophthalmitis resulting in hypopion now treatment, hypopion is a pus collection in the vitreous area. The ideal treatment now is intravitreal and topical antibiotics. You have to inject the antibiotics into the eyeball, into the vitreous matter, which again is a somewhat bit sensitive job. Unlike injection into the subcutaneous or intramuscular route, here injection would be somewhat a more sensitive job. And that is the standard protocol of the treatment now. With the antibiotics, the resolution is quite high. Then topical steroids or cycloplegics also are usually used as a symptomatic treatment. If it has to be, if it doesn't yield to the medical treatment, surgical treatment of vitrectomy and intravitreal injections also are the other options of the treatment. So, in case of hypopion condition, which we now consider as a medical emergency, whether the same protocols of the treatment which are mentioned in Sushruta again will be practical or not, again question mark could be there. I have not any experience of treating that condition. Then in case of Puyalase, Shonisa Mokshanam, Jahitam Thriva, Vipanahananja, Krishna Vidishta, Ikshana Pakadhati, Yathavidanam, Bhishta Prayojaha. In the Puyalasa, there is a dacryocystitis condition, the Rakta Mokshana and Upanahana is suggested, and all that treatment which is suggested in case of the Akshipaka also can be used in these conditions. Kasisa Sindhu Prabhava Ardhakesu Hitam Bhave Anjana Chatra Kshaudranvijaihi Ebihi Atha Upayajyat Anyattu Tamraya Satyodayuktehi. Another of the yoga which is suggested in dacryocystitis for Ranjana is Kasisa Saindavaravana Shinchiyat set. स्नेहादिभिः सम्यक् आपास्य दोषान् तृप्तिं विधायात् यथास्वमेव प्रक्लिनवर्त्मानम् उपक्रमेत सेकाञ्जन आष्ट्योत्तरनस्य धूमेः. In the प्रक्लिनवर्त्मा blepharitis conditions also, the treatment is similar, where you have to give the dosha shodhana, raktamokshana has to be done. Then same treatment with the seka, anjana, ashtyottana are to be treated. And some of the drugs which could be used are मुस्ता हरिद्र मधुक प्रियंगु सिद्धार्थ रौद्रोत्पल सारिवाभिः क्षुण्णाभिः आश्चोत्तरमेव कार्यम् अत्र अंजनं च अंजनमाक्षिकं स्यात्. अंजन with the musta हरिद्र etc. can be used as पत्रं फलं च आमलकस्य पक्त्वा क्रियां विदध्यात् अथवा अंजनार्थे वंशस्य मूलेन रसक्रियां वा वर्तीकृतां ताम्रकपालपक्वां रसक्रियां वा त्रिफला विपक्वां पलाशपुष्पैः करमञ्जरेर्वा. The other combinations could be used as amalaka patra, leaves of amalaki with as in the form of rasa anjana. Then vamshamula, that's bamboo's roots, also could be used for rasakriya, and which is prepared in a copper vessel. And palasha pushpa with trifala and is kharamanjali is apamarga, also pushpa can be used. पिष्टाच्छिकव्याः पैसामलं वा कांस्यस्य दत्त्वा सहकान्तवेन प्रत्यञ्जनं तन्मरिचैः उपेतं चूर्णेन ताम्रस्य सह उपेज्यं. The goat's milk with the kamsyamala, that's the residue over the bronze vessel, and tantupashana. And these also with the maricha also can be used for anjana. Praklinavartmanya yete yogaha prayogyasya samiksha dosham. In the praklinavartma, that's blepharitis conditions also, the similar yogas are used. Sakajjalam tamraghate gristam sarpitam tuthakam anjanam cha. Kajjali and in the copper vessel with the prepared with the ghee also is used. As far as the dacryocystitis is concerned, the current treatment would be acute antibiotics. Acute conditions in the antibiotics would be the choice of the treatment. When it becomes chronic, irrigation is one of the options, or dacryocystomy or balloon plasty, where the closure or blockage of the dacryocyst tear gland cells would be affected or can be treated. Praklinavartma, as you have discussed, it has all the features of the periorbital edema, and periorbital edema often is produced due to systemic causes like nephrotic syndrome etc. And in that condition, the treatment protocol should follow that systemic causes. There is no need of any specific local treatment. Maybe some soothing agents would be prescribed. Thus, in brief about the Raktabhishyanda chapter. So, iti Sushruta Samhitayam Uttaratantrangate Shalakyatantre Raktabhishyanda Pratishodho Nama Dwadashodhyaha, and we will conclude today. The next is about lecture, which we will discuss on some next session.